Last episode, we had addressed how common fatty liver disease actually is. But if fatty liver truly is everywhere, what can we do about it? How can we stop this escalating trend in its tracks? My name's Afik, and together on the Vital Sign podcast, we tackle some of life's most overlooked bodily mysteries. We've discussed what some believed to be the soul of the body, or what we know today as the liver. We've heard just how common liver diseases are, especially in Malaysia, and how silent it is while it's impacting our lives. But not to fret, because today, we'll be giving you the lowdown on how to identify symptoms, as well as treat and prevent liver diseases so that your body will function at its best. I'd like to welcome back who I think is now a good friend of mine, Dr. Loong, who specializes in gastroenterology. I did it again.
Pronounce it correctly.
Thank you very much. Thank you very
glad
much.
to be back again, Afik. Today let's talk about the symptoms of
Yes.
the liver disease and fatty liver.
Mhm.
Like I must reiterate, fatty liver disease at the initial stage has no symptoms at all.
Mhm.
So in fact, if you want to look for fatty liver disease in one, you have to do tests, be it blood tests, imaging studies, especially for those who have high risk. For instance, if they are obese, they have diabetes, they have high cholesterol, I think they must be actively seeking out for this fatty liver disease problem in them. Okay, but the common symptoms when one develop can be something so simple like fatigue. They may have sometimes vague discomfort, bloating in the abdomen, and for the more severe case, the eyes may turn yellow, something we call jaundice. And they may also have food retention, leg swelling, and at the later stage when the liver is losing the function, they may have confusion. They may develop rashes called spider nevi, rashes that looks a bit like spiders. They may develop breast in men because they cannot scary, right?
It's kind of scary.
Because they cannot metabolize estrogen. So there'll be too much of estrogen in them. They may lose interest in sex. So all these things can actually happen when you have very bad liver cirrhosis. But remember, if we want to tackle the problem at the beginning, which is reversible, we have to actively seek for the problem. And we cannot wait until all the symptoms to come up, then only we will start treating.
So I think you've mentioned a whole list of symptoms, but the one that I think is most I've heard people say is fatigue. I think fatigue is something that a lot of people go through.
Yeah,
right?
fatigue sometimes, the thing is, it can be just so subtle when you
Yeah.
have fatty liver disease, but fatigue can be due to so many things.
Yeah, exactly.
So sometimes, many times we will tend to think that it's just we being overworked,
Yeah.
not getting enough sleep,
Yeah.
spending too much time on Netflix
Yeah.
and our phone. But sometimes it can actually be because of fatty liver disease and liver disease itself. So sometimes if it's a bit too much, a bit more fatigue than usual, I think we should sometimes look at this possibility, which is fatty liver disease.
But how do you define? Because fatigue, I think, is not quantifiable, right?
Yes.
It's not an amount of fatigue, right? So if, like, sometimes I get tired, but what is the point where I must be aware and tell myself that this fatigue doesn't feel right?
Yeah, if there's a reason to be fatigued, for instance, you stayed up late at night, the next day you are tired, it's normal. But then if you don't have any special reason to be fatigued, or you think this tiredness or laziness is too prolonged, maybe it's not harmful to get it checked. Anyway, it's just a blood test or imaging study. An ultrasound doesn't cost a lot, and there's very little harm it will do to your body anyway.
Why I think it's really scary is for a lot of young people, like people my age, 29 and below, people who stay up late playing video games, right? We might feel fatigued the next day. Unknowingly, it might also be fatigue caused by fatty liver disease.
Correct.
But it's difficult to pinpoint that because there was a reason to be fatigued because you were up late. So I think this is a risk factor, right? And this is also why I think we are responsible for how we feel about our body. And we need to understand when we start to feel like our body feels different. This isn't right. This isn't how I usually am. And I think at that point is an extension to your point earlier. That's when you need to go get it checked, go see a doctor.
Yes.
So going back to something that we spoke about in the first episode, doctor, is what happens if liver disease is left untreated.
When the liver disease is left untreated, if you are unlucky, the disease will then progress.
Yeah.
And eventually will develop liver cirrhosis.
Yeah.
You will lose the function of the liver, all the important functions. Some of them are essential, and some will develop liver cancer. We have to treat it earlier, especially when there is a treatable cause. When there's a treatable cause, we have to treat it. And many times, even if we cannot reverse the process, we can actually stop the disease from progressing further. And usually that is good enough for many.
So let's imagine I came in to see you, right? And then I say I'm fatigued. I don't specifically say it's fatty liver disease, but I tell you about all these things that I'm feeling that may tell you that I need to get tested for fatty liver disease. What would the diagnosis process be like?
Most doctors, we are trained to first take a history. So we will go through whether you have any stress or any special reason for the fatigue. We will go into your past medical history. We will go into your occupation, what you do, your lifestyle, whether you smoke, you drink, all these things. And then if we cannot find anything, then we will do blood tests. We may do imaging tests like ultrasound. And having fatty liver disease in mind, we will actually actively look for something like this. And of course, after doing the test, usually we'll be able to get a diagnosis. And based on the diagnosis, we'll give the appropriate treatment.
Okay, so to break down how this disease is diagnosed in ways that will be clear for our viewers to understand is there will be blood tests that we can take. So first of all, an understanding of the history, which means a doctor like yourself will go into investigation mode, investigative, right? You find out about what they do, if there is any reason for them to be fatigued in the first place.
Yeah, investigation, apart from blood tests and imaging, is also interrogation, just like a detective.
Because you need to find out.
Yes, we
you need to find out
interrogate the patient.
You need to get to the bottom of everything first, right?
Yeah.
And then after that point is when patients can get blood tests, imaging, something called a liver biopsy.
A liver biopsy will be at the end. Liver biopsy is basically taking a piece of the liver out to look at it. It is very helpful, gives a lot of information, gives us the diagnosis, but it comes with a small but significant risk and sometimes even mortality. So sometimes we try to stay away from that unless there is no other choice.
So the biopsy is worst case scenario.
In certain condition like last resort, if we cannot find the diagnosis or whatever we do is not helping the patient and we need more answers. So with that kind of situation, we will take a liver biopsy. Otherwise, in most instances, history, blood tests, imaging, and sometimes another scan called fibroscan will be adequate in most conditions.
And what about ultrasonography?
Ultrasound is one of the imaging that we do.
One of the imagings, okay. After diagnosing, right? After diagnosing fatty liver disease, so let's say the story is still the same. I went to see you, I'm fatigued, you do the history check, and then it turns out I have to do more tests. So I take a blood test. And then after I take the blood test, turns out I have fatty liver disease. Now we have to go into the conversation of the diagnosis is as such. How do we treat it?
Okay, so normally this is what I will do.
Yeah.
After ascertaining the diagnosis, I will first educate the patient, tell him what is fatty liver disease, what will happen if you don't treat it, and how to treat it. Okay.
Now you can just send him the podcast.
Yep, we'll send him the podcast next time. Okay, Afiq, please do the needful. Anyway, what we will do is we will then look at the liver disease, stage it, see how far the disease has progressed, and look at other associated factors, like I said, metabolic syndrome, whether they have diabetes, high blood pressure, because we are not just treating the liver. We are
Yeah.
treating a patient with many, many organs. So we don't treat just one organ. Okay, so we have to look at the other thing, patient in a holistic way. So we have to check up for all these other cardiovascular risk factor. We also have to address their social background, their activities, and we have to also educate about lifestyle. So there's a lot of other things that we have to do, especially for the first consultation. Then we will tell them, look, this is the plan. This is your problem. This is how you can treat it and change your future. And this is the plan. And you have to stick to the plan to win. Win not for me, but for yourself. So that is usually what I will do at the first consultation.
At this point, the assumption is that it's still reversible.
Yep, is like I said, if you diagnose it early, it's reversible. Even if I cannot reverse the thing altogether, I will try to stop the progression because the last thing you want is the disease to continue to progress and patients start developing all the other complications like bleeding problem, vomiting blood, getting confused because the toxin is not detoxified by the liver and goes to the brain. All these other issues that can kill the patient actually.
Yeah. So some of the things that are lifestyle changes that come to mind for me when we talk about this is, of course, keeping a healthy diet. We mentioned that before. Balanced diet. Difficult to do in this country.
Difficult to do, but can be done.
But can be done. It just requires discipline.
Yes.
Exercising is another lifestyle change that can happen. If you are a smoker, quit smoking. And this goes for vaping as well, I'm assuming.
Yep.
Limit alcohol consumption is
Limit
also
or stop alcohol consumption.
It's also another lifestyle change. What about supplements? Are there supplements that people can take alongside these lifestyle changes to help them lead a better life and prevent or treat fatty liver disease?
Basically, most of the supplement, they do have some science behind it. For instance, this molecule called SAMe, S-adenosyl methionine. In short, SAMe. I will not try to mention it too many times because I will get my tongue all twisted. SAMe. It is a naturally occurring substance in our body, and it's important for so many functions, from regeneration of the cells, production of neurotransmitter, building the cell walls, detoxification, and they detoxify things, antioxidant. So this molecule basically is actually quite short in patients with fatty liver and liver disease. So if we provide a supplement, a molecule like this, it will definitely help the liver because, like I said, the liver is a very resilient organ. It can regenerate. But sometimes when you're ill, just like when you're ill, although you're a tough guy, you may need some help. So when we give all these naturally occurring molecules, which is deficient in a sick condition, a morbid condition, it will help the liver to become stronger. And then the liver can then start to fight those problems. Of course, we also have to remove those things that is attacking the liver, be it too much fat or alcohol or a harmful medication to the liver. So first we remove the causative agent, and then we help the liver to recover. We identify all the other associated factors or other medical condition, comorbidities like hypertension, hyperlipidemia, diabetes, and treat all this together. Then only we will get a good outcome for the patient. Like I said, we are not treating just the liver, but overall. Fatty liver can be one of the target organ for some of this condition like metabolic syndrome. But we have to address all these other issues in a patient.
Okay. So help me understand SAMe a little bit more, right? You mentioned SAMe is a naturally occurring substance inside the body, but there are supplements that have SAMe in them.
There are some capsule that has SAMe, and you can actually purchase them. There are also, of course, other supplements like silymarin and all those things, milk thistle. But SAMe is one of those interesting supplement that I use, and actually we can see the difference after putting the patient on all this SAMe. Together with the other intervention, you will see some difference. So SAMe basically will protect, detoxify, and sometimes help in the recovery of the liver.
Okay.
And we can actually see these changes if we do everything together,
Yeah.
hand in hand.
How quickly can these changes take effect?
If you do everything right, you can see the difference within 1 to 2 weeks. But again,
Okay.
you have to do everything right.
Right.
Of course, not every patient, all patients will see the similar response because all this is multifactorial.
Yeah.
Okay, but if we can address all the issues, we can see the improvement within 1 to 2 weeks.
It doesn't mean once you take the supplement, you can stop exercising, you can stop
Of course, that
maintaining a
one
balanced diet.
lifestyle and diet will be the foundation.
Yeah.
And we must always remember the foundation is the most important.
Yeah.
Okay, supplement is adjunct,
Right.
adjunctive treatment to the rest of the things.
It means alongside a support system.
Yes, yes. For instance, when you take SAMe, sometimes even the fatigue can get better. There are studies that shows that fatigue will improve.
Okay.
Because SAMe will help us to produce some neurotransmitter, and one of them is actually the happy neurotransmitter.
I see.
And in some countries, they even use it for mild depression.
That's interesting.
So if you want to be healthier and happier, if you have fatty liver, one of the things that you may want to consider is SAMe.
SAMe supplements lah. What about vaccinations? Is it efficient in preventing liver disease?
Vaccination definitely is very important. And of course, in liver disease, hepatitis B vaccination is very important. Therefore, our country has adopted this vaccination program. Now all the newborns will be receiving the vaccination. And because of vaccination, we are seeing less and less patients with hepatitis B.
Okay.
We hope one day there will be, of course, it's a bit hopeful. One day, in the near future, there will be no more hepatitis B, just like smallpox. I can see that number of patients with hepatitis B used to be like 5 to 7%. Now it's like so much less. It's maybe like less than 1%.
Oh wow, less.
Yes.
Oh,
For
I was
the
expecting
newborns,
you to
the
say
newborns,
1-2%. Yeah.
newborns. That's why vaccination definitely will make a big difference. That's why what I'm trying to say is because of vaccination, because of treatment for hepatitis B, because hepatitis C is curable, fatty liver will become the next big thing for hepatologists or gastroenterologists as far as liver disease is concerned.
Okay. Okay. And I think a bulk of this segment of the conversation refers to treatment of fatty liver disease as and when it is treatable, as and when it is reversible. But there are serious cases where people develop chronic liver disease, right? At this point, what can be done?
So sometimes it's quite sad. Patients come with chronic liver disease with symptoms, with complication, with ascites, meaning they have a lot of water in the belly, leg swelling, eyes yellow, a bit confused. Sometimes the confusion can come in just because they can't pass motion. Constipated for a few days, confused. Get some infection, confused. It's quite sad. So all these patients, we have no choice but to protect the liver as much as we can and treat all these complications. So it depends on what kind of complication they have. So, but that's the sad part.
Yeah. Would liver transplant be one of the ways to
Yes,
move
some
forward?
patients by right will benefit from liver transplant. But unfortunately, liver transplant is not easy. It's not easy to get a donor. So we are very scarce of donor. So it's not easy. And before we do liver transplant, we also have to see whether the patient is suitable, whether they have very bad infection, whether they are mentally prepared. Because even after liver transplant, if it's successful, we still have to talk about the problems after transplant. We must understand after transplanting a patient, they come with a new set of disease. They will be on immunosuppressant for lifelong. They can get infection every now and then. The cost of all this, the immunosuppressant, the infection every now and then, the rejection. So it's a very sad thing, but it's something that we can do when there's no other option, liver transplantation. Yeah. But hopefully we don't have that many patients who will go into this.
That's like another type of last resort.
Yeah.
We don't want people to go through
sad ending, but we can still allow the patient to continue to live. But then there's a lot of other issues after transplantation.
Yeah, right. So I guess the focus really is not allowing it to get to the point where you need to tackle things at the last resort,
Yes.
like liver transplant, and then biopsies was another last resort that we spoke about.
That's for the diagnosis.
Yeah.
So the most important is just prevention. If
Yeah.
cannot, treat early. Treat when it's irreversible.
Yeah.
To do that, we have to be proactive again.
Sometimes it feels like I shouldn't have to go to the doctor for every wrong thing I feel in my body. But based on this conversation, it sounds like whenever you feel something off, your body is trying to tell you something. And I don't think doctors mind you coming in for every small thing, because it means that you want to know more, right? You want to investigate about what's happening with your body and find out if there is anything that's underlying.
Yeah, basically, I would like to emphasize that doctors is your partner in health. You don't have to be seeing a gastroenterologist. It can be just your own general practitioner, your friend.
Yeah.
So if you feel that there's something wrong, just go and discuss with your general practitioner, doctor friend, and see whether there is a need to do further tests. And usually, if you are a regular patient, the doctor will usually give you a good recommendation. And of course, for instance, if you feel fatigued because you have not been sleeping, you have been watching TV or playing with your handphone all night, you can just do some simple experiment. Stop doing that for a few days and sleep well and see whether your fatigue goes away. If it goes away, then you're normal.
Yeah.
But it's
that
not
makes
good
sense.
to continue to do that unhealthy lifestyle. Yep.
So speaking about SAMe, right, doctor, I think something that we sort of overlooked, and I wanted to ask, a question I forgot to ask is, who is SAMe for? Who can take SAMe?
Actually, any adults can take SAMe. So especially if you have liver disease in general, fatty liver disease, patient with raised liver enzymes, patient who has fatigue, all these patients will benefit from SAMe.
Awesome. And I think with that, we've actually come to the end of the discussion about fatty liver disease. And I think it's been a wonderful discussion. You've taught not just me so much about fatty liver disease, but our viewers as well. And my hope is that if somebody who's watching this can relate to anything that we've spoken about, that they either get themselves checked and hopefully prevent something that might be more difficult to deal with later on, or scares you into living a healthy life. I think that's essential. And the biggest takeaway from the last two episodes we've done is that fatty liver disease and chronic liver disease are completely avoidable.
Yes.
Correct? It's completely avoidable as long as we stick to a few lifestyle changes and we are disciplined enough to see it through. So even though the liver can regenerate, it doesn't mean that we don't have to take care of it. We don't have to take care of ourselves. And I think that you have said it very, very well in this episode. And you've actually laid out a system for how to actually lead a healthier life, because we get that advice all the time, lead a healthier life. But what does it mean to lead a healthier life? What we've discovered is keep a balanced diet, exercise, and if you have all those things intact and you're disciplined enough, you can help make it more effective by taking SAMe.
Yeah. So most of the time it's just so simple.
Yeah.
I think after all the discussion,
Yeah.
are you afraid with all the statistics that
I
we have
am.
shown?
I am.
You should be.
Yeah, I am.
You should be. And in fact, actually, all the doctors and the public, okay, including myself, should be, because fatty liver disease will become a very, very important thing. And by just doing something very simple like what you have said, will actually change the whole the scene. So I hope all of us, including myself and Afiq yourself, we have to do something right for ourselves and for our loved ones, so that we can protect our liver and all the other organs in us. Then only we can have a fruitful and healthy life.
Thank you very much, Dr. Loong.
You're most welcome.
I hope I get to see you soon, and hopefully it's not at one of the hospitals that you
Hopefully
are
not.
based in.
Hopefully not.
I think I need to make some lifestyle changes myself.
We all need to.
Yeah, thank you, Dr. Loong.
You're most welcome.
So you see, it's not surprising that the preventative measures to tackle liver disease are simply tips we should already be living by to lead healthier lives. So maybe it's time to swap out that teh tarik for some ice swam, guys. We hope this series gives you the nudge to start taking control of your life before it's too late. I have been your host, Afiq Kamarudin, and this has been the Vital Sign Podcast. This podcast is a production of Renegade Radio with support from Abbott in Malaysia. It was produced by senior producer Kelvin Tay and producer Ragini Ravi. Written by Alisa Pong Lee Ann. I've been your host, Afiq Kamarudin. Catch you next time on the Vital Sign Podcast.